And good afternoon, everyone. Thanks so much for joining us for this, our first COVID-19 press briefing of the week. We have lots to discuss today. Today, Orange County Mayor Jerry L. Demings will discuss the various vaccination sites, requirements needed to be vaccinated, some information regarding law enforcement, details of those 60 years old and older, and other vaccination criteria. The mayor will also discuss our COVID-19 infection numbers and the fact that it is too early to spike the football, not in the end zone yet. The mayor will also discuss the work of our strike teams and some restaurants that are doing the right things as it relates to CDC guidelines. Orlando Mayor Buddy Dyer could not be here with us today, but Dr. Raul Pino from the Florida Department of Health is here to discuss details on the vaccination process as well and COVID-19 training in our area. We begin with Mayor Demings. Mayor.
Hey, good afternoon. Hopefully you all had a great weekend. This past Saturday, March the 13th, marked the one-year anniversary of Orange County being under a continuous state of emergency. So today marks the 367th day, and I'm proud to say that during this entire year plus, couldn't have been any more proud of the men and women who are serving in our community, who have been on the front lines of dealing with this pandemic. Let me just say thank you to Mayor Dyer. Although he's not here today, Mayor Dyer has been a great partner in this effort over time, and certainly our health partner with the Florida Department of Health at Orange County, Dr. Raul Pino. He has done yeoman's work with us. In addition, let me just say thank you to the other municipalities who have been working with us, and I also thank our community health partners. We couldn't have gotten to this point without all of those various community health partners. The largest health hospitals here, Advent Health and Orlando Health and HCA, have played an instrumental role in providing guidance and expertise to us during this period of time. So as we move forward, each week I try to ensure that we give you the goals for the week, and I'm going to do that today. Of course, the number one goal, Steve Hudak, you can tell us what it is, right? Stop the spread of the virus in our community. And number two, continue offering free testing within our community. And number three, we want to work with our federal and state authorities on increasing the number of residents vaccinated. And number four, our goal is to get our economy back on track. It took a year to begin to feel that we are finally recovering from the pandemic and to see tangible signs of recovery. There's good news. Over the weekend, President Biden said in his address last Thursday that he has directed states to ensure everyone is eligible by May the 1st. So very quickly here within the next month and a half, you should see the expanded group of individuals eligible to receive the vaccine increase significantly. Getting the shot into more arms of individuals is always a priority and a continual goal of mine. That's why on this past Friday, March the 11th, I sent a letter to Mr. Kevin Guthrie, who serves as the Deputy Director of the Florida Department of Emergency Management. I requested the expansion of our eligible groups to include all employees of law enforcement agencies, corrections agencies, and fire departments, in addition to providing the vaccine to those 60 years old and above. I am pleased to announce the state has granted this request in Orange County, so all of those who serve in law enforcement, corrections, and fire departments can be vaccinated in our county. Therefore, the requirement for vaccination no longer has to be restricted to being a sworn law enforcement officer or certified firefighter or corrections officer. It now entails anyone in those agencies, from forensic staff to administrative team members. Our convention center continues to make available the opportunity to these employees You can get information by going to our website at ocfl.net/vaccine for more information. I want to also talk about the positive numbers we're seeing as we enter the second year of the pandemic. Our 14-day rolling average percentage positivity rate is now 5.1%. 3 weeks ago, the 14-day rolling average was 7.1%. Back to during the holiday period of time, it was double digits. The dramatic decrease in the positivity rate may have something to do with the percentage of people who are now vaccinated in our county. I'll leave it up to Dr. Pino to talk more about the specific numbers. That's why we want to stress the importance of free testing offered at Barnett Park and the Convention Center. We ask that you please take advantage of getting tested. If you have any symptoms or come in contact with anyone who is COVID positive, testing is still an important tool in containing this virus and keeping our numbers low. It is spring break, and we want to highlight the importance of avoiding large crowds, but we know that many are going to go to places where there are large crowds. We just simply ask that you wear a mask, particularly if you don't know the people around you. Since the beginning of the pandemic, there has been a total reported of 118 plus thousand COVID-19 cases in Orange County. Never thought we'd get to that number. Some 1,147 residents of Orange County have died from the novel coronavirus. Yesterday, I had the opportunity to read an article in the Orlando Sentinel that highlighted the pain that hundreds of COVID-19 families are still experiencing from the grief of their loss. One of them, obviously, was Steve Hudak, who comes here and covers the pandemic and other stories for the Orlando Sentinel. He himself has experienced loss in his family. And so I've asked before, is there anyone here who does not know someone who has contracted the virus or who has died of the virus? If so, raise your hands. Okay. There's no hands up, so that means that everyone here, and perhaps even within our viewing and listening audience today, knows someone who has contracted the virus or they know someone who has died of the virus. So that tells you that it is pervasive within our community. There are some families who have lost both parents or a sibling or a child. We continue these news briefings in an effort to keep everyone informed and avoid the loss of further life. We ask that you continue to keep those families who have lost a loved one in your minds and your prayers. The disease continues to spread. Today, we have more than 3,000 vaccination appointments booked at the Orange County Convention Center, and there was a high demand for the 60-plus eligibility expansion. There are still appointments available this week. You can go to our website at ocfl.net/vaccine for more details. This weekend, the Orange County Public Schools were offered vaccinations at 5 different local high school sites. I am told that 1,850 teachers and staff were vaccinated. I don't see a representative from the school district here today. We have another opportunity to get vaccinated through our partnership with Advent Health. The Florida Department of Health in Orange County is allocating another 3,500 doses to Advent Health that will be distributed this Friday, March 19th, at a pop-up site outside of the Orlando International Airport. The vaccines at this site will only be available to those 60 years and older who are eligible under state and federal guidelines. For that site at the airport location appointments are required. A sign-up link will be available on Orange County's website at ocfl.net/vaccine. We are thankful for our community partners again, like Advent Health, for stepping up to help us distribute vaccines in Orange County. In addition, thankfully, FEMA is in our community as well. They continue to run the site at Valencia College's West Campus 7 days a week between the hours of 7 a.m. and 7 p.m. In East Orlando, the FEMA satellite site at the South Econ Park Gymnasium continues today through Wednesday. You can go to the South Econ Park Gymnasium from 9 a.m. to 5 p.m. All of the FEMA sponsored sites are walk-up only and no appointments are necessary. By walk-up, I mean drive-up, etc. Since Friday, a total of nearly 8,000 people have been vaccinated at our local FEMA sites, including our FEMA hub at Valencia's West Campus and the other satellite sites. Other FEMA satellite sites will be announced soon. We're in discussions with FEMA. In addition, we are working with the state to have local churches as vaccination sites for one-day events, and we'll share details on that once the final details have been worked out. Finally, the Florida Department of Emergency Management is also planning to open a COVID-19 vaccination site that will be open for 10 weeks at the Orange County Public Library facility located at the South Trail branch, located at 4600 South Orange Blossom Trail. Again, the South Trail branch located at 4600 South Orange Blossom Trail. We will be putting details up as well. All of these opportunities for vaccinations in various areas around the county are a positive message for our residents. Last week, I mentioned to you at the Thursday press conference, we are working with the Florida Department of Emergency Management to collaborate with them on a pilot initiative to begin this week. I'm told that today, some 300 state canvassers began to canvass and do door hangers in neighborhoods identified as having a high social vulnerability index score. They started in the Pine Hills, Rosemont, Lockhart area today. This is another push to reach people who may not have access or means to receive the vaccine. Neighborhoods are being identified by the county in partnership with our cities based upon the Social Vulnerability Index data. Canvassers will be paired with firefighter paramedics in this effort as trusted public officials. Again, the current locations that they are working in today is in the Pine Hills, Rosemont, Lockhart area. We have not started doing vaccinations yet. Later this week, the canvassing teams will move to other underserved neighborhoods, and we hope to, by midweek, begin actually providing vaccinations in people's homes identified through this process. Also, I mentioned on this past Thursday that our compliance teams will continue to go out to inspect and assist businesses to ensure the facial covering executive order and CDC guidelines are being followed. I want to remind everyone that this is a safety measure we are taking seriously to protect this community and make the public aware of bad actors. With that, 18 businesses on the east side of Orange County were visited this week. 5 this weekend, I should say, this past weekend. 5 of these businesses were found to not be in compliance. Several were repeat offenders. They will be named: the Knights Pub, the Knights Library, Infinity Nightclub, and Pizzeria Valdiano, and the Social House were all found to not be wearing facial coverings and social distancing was not observed. As I mentioned on Thursday, our Orange County compliance strike teams will continue to go out and to do inspections and assist businesses to ensure the facial covering executive order and CDC guidelines are being followed. I want to remind everyone that this is being done as a safety precaution and should be taken seriously to protect yourselves and others. And finally, I want to thank all of you for the continued generosity that we have seen within our community and the generosity shown to those on the front lines. There's a local food blogger, Tasty Chomps, Ricky Lee, who is also one of our active Orange County citizen volunteers. He organized a GoFundMe drive for restaurants to take snacks and food to the healthcare workers at the Orange County Convention Center vaccination site. So let me just say thank you to Ricky Lee for that effort. I will acknowledge a few of the businesses who supported that effort. The Oshio Korean Barbecue, the Tien Hong Market and Banh Mi Boys, Hunger Street Tacos, the Maleo Bakery, Old Cuban Cafe, and Old Red, the Greenery Creamery, Insomnia Cookies, Kelly's Ice Cream, and the White Castle Burger franchise here in town. Thank you to all of them, and let me turn it over to Dr. Raul Pino at this time.
I don't know where I was. I missed the Old Cuban Cafe. And thank you to all those places. The workers really appreciate to have a snack, a quick snack when they can. So the mayor gave you much of the numbers, so I'm going to concentrate in recovery rate, which is 97%, probably the highest that we had. And our 14-day rolling average is at 5.1, and that's for PCRs, negative and positive. And I was expecting to be below 5 today, but it's at 5.1, and it will continue to decrease slowly. Now, from now on, it will be very slow decrease. Unfortunately, we have reached 1,147 deaths. And we have additional 9 that were added since we talked to you last. 6 female, 3 male. And the 8 had unknown conditions. Known conditions. 1 have unknown condition. 1 death was from December, 4 from February, and 4 from March. Could you show the graph that we have there, the other graph? So I wanted to illustrate to you, these are the number of deaths per month, the day that they were reported, not the day that they occurred. If you go by the day that they occur, as it was reported by the Sentinel, I believe during the weekend, the highest month will be January. But right now, by the day that they were reported, January and July are at the same level, exactly at the same level. But what I want to illustrate here that in March, and we are halfway through March, we only had, not that I'm tempting anyone, but I only have 8 deaths. And that's very low for what we have experienced in the past. And if you look into the graph, the closest that was, March last year, we have 4, and May last year, we have 9. So those are the closest month that we have before we got to this point, and undoubtedly, vaccination has a lot to do with it. And also preventive measures that we still have to continue to have in place, and it's important for people to know, and I get asked all the time, that washing your hands, wearing your mask, and watching your distance are critical at this point. Very, very critical. There are other measures that are less important, and that has been always very, we always debate about it. One of those is temperature control. And I explained before that there is some issues with temperature control. As most people right now, we know that a lot of people are asymptomatic, and those who are asymptomatic have played a larger role in transmitting than we initially expected. Our percentage of asymptomatic people always range around 25 to 30%, or other places around the country have seen larger numbers. And it doesn't mean that we didn't have it, so we didn't detect it. It could be that another large number of people were asymptomatic in the community. And also, beside temperature control, these type of physical barriers, the plexiglass, also add issues because it's an additional surface to clean. It's an additional surface for the virus. People remove their mask because they cannot hear each other through the glass. And sometimes you even see at the stores, the clerks going around the plexiglass to give you what you need. And that's why we always have those issues with these type of barriers. Mask is the most adequate barrier because we take it everywhere that we go. And as long as we have it on, we are blocking the virus from getting into other people. And also, spring break is coming. We are concerned, and in the summer, I hate to have to drive an hour to go to the beach. But right now, it's a good thing not to be at the coast. I think that our coastal towns will see larger numbers of people coming to celebrate spring break, and that's always a concern. You also saw what happened in Miami Beach during the weekend with unruly crowds, and we hope that that will not be the case here. But still, we will. Our parks are reporting that are fully booked for the entire month. Many of the parks, our occupancy rate is going up, so that means that an influx of people coming into the county, and that's what is important, to continue to have these preventive measures in place, because we are in a very good place right now. Who can be vaccinated at the Orange Convention site? Thank you, Mayor. Mayor took the initiative of, negotiating with the state an increased spectrum of who can be vaccinated at the Orange Convention site. We still have appointments for the rest of this week, not many, and about 2,000 left for next week. But just to give you an idea, this weekend, this county vaccinated about 20,000 people were reported to be vaccinated into the state. So we are looking pretty good on that one. The total number of doses, these are doses, not people, total number of doses administered in our county so far, 331,880. And of those 289 doses, 499 were given to Orange County residents. When we talk about percentages, let me give you this first one. Total people that have completed their vaccination, meaning they either had J&J, which is only one dose, or they have the two of the Moderna and the Pfizer. We have complete vaccination in our county for 104,003 individuals. Now, this number could be larger due to the fact that in here, the VA vaccinations are not included. So the state is advising us that our rate could be 5 to 8% higher than it is. So to give you the rates or the percentages, the number of residents that have received at least one dose are 194,340, and that is a 13.73% of our population. And when we talk about 65 years and older, the number of individuals that have received at least one dose in that group is 104,926, which is 65% of the people in that age group in our county. Just to give you an idea, our total population estimate is 1,415,000 with 479. Our population older than 18 is 1,048,026. And the population who we estimate to be about above 65 is 161,327. We have some way to go, but we are on our way. Thank you.
Okay, we're going to open it up to any questions. I know Ms. Sherry Babinski from the Orange County Public Schools came in, so if there are any questions related to the school district, she is here. We also have Mr. Tim Boldick from our compliance and strike teams that's here on the ground. And we have one of our battalion chiefs from Orange County Fire Rescue, Chief Scott Egan, who's here, who's been working on some of the logistics associated with the new initiative to inoculate or vaccinate people in their homes. So with that, we'll open it up for any questions at this time.
Lauren Seabrook, Channel 9. Mayor, my question's for you today. I'm curious about, after last Thursday's press conference, I know you guys were still kind of talking with the county attorney and stuff. We heard from a lot of people who said, is there a way to just kind of publicly let everyone know, you know, I know you guys let us know, but maybe if there was a website to let everybody know which places are failing their inspections. And then also, I'm just curious about these repeat offenders that you, I'm sure, get sick of talking about every single time. What can you do at this point to these repeat offenders that's different?
Yes, we will put on our website the information about those who have been found to be in violation. Some of those sites have not only been cited by Orange County, but some of them have been cited by the state. Of course, the governor did not set aside the fines that were issued by the state with his executive order, only those issued by local governments. And our county attorney's office is still exploring if there are any additional legal options for us. But in either case, we are going to continue sending our compliance teams out because I think when you provide inspections, you get better accountability. And clearly, because we still have a significant way to go before we reach that herd immunity, it means that we really need to double down and continue adhering to all of those guidelines that Dr. Pino just talked about. So we're not going to back up from that as a community. We're going to continue to make decisions that hopefully will keep our citizens as safe as we possibly can during a public health crisis.
Troy Campbell with Channel 6. This question is for Dr. Pino. With appointments still available at the convention center and all the data we see, the eligible groups, we're hitting just over 60% with those groups before we ask the state for another group. Does that concern you with that percentage of 65 and up, 65%, healthcare workers, similar? Orange County Public School Medical Advisory Board said they're sitting at about that same percentage.
Yeah, it's an interesting perspective in the sense that, you know, it's a catch-22. We have been able to vaccinate quickly in our county, and so there is an increase in offer versus the demand that we have experienced for that age group. And I think that was part of the reason why the mayor also wanted to open it up so that those appointments and offer these services to others. But if we are allowed to open our county, then it will also get inundated from surrounding communities if we lower our age before the state does. So it's kind of complicated in that sense. But we cannot wait until the day that is open to everyone, so that anyone who wants to get vaccinated could get vaccinated. And again, to reiterate to people, we do have the appointment, we do have the vaccines. We are at that point that we alert people that we would be maybe 5-4 weeks ago. We said there is going to be a point where we are going to have all the vaccine needed. At that point is here. We are getting in our county a great number of vaccines, and the coming of J.J. Johnson & Johnson into the floor is a game changer for some of the activities that we are doing.
Buenas tardes, Félix Pirela de Telemundo 31. Tengo una pregunta para el doctor Raúl Pino y otra para el alcalde Demings. Doctor, su principal preocupación esta semana, estamos en Spring Break, han llegado ya muchos turistas acá a la Florida Central, y para el alcalde Demings, luego de la postura del gobernador de eliminar las multas en los negocios en todas las localidades del estado, ¿cuál es la postura para el día de hoy del condado que sigue con el Strike Team inspeccionando los negocios? Muchas gracias.
So the question was for me, if my major concern is the spring break and how I see this. And yes, that is a concern, especially because of the age group of the people who come for a spring break. And those are people who tend to socialize and move a lot and go to bars, and we know what had happened in the past. So la respuesta en español, la pregunta fue acerca de la preocupación con respecto al spring break. Y sí, estamos preocupados porque estamos en un buen momento y esperamos que continúe de esta manera, pero nos preocupa. Las personas que vienen para spring break generalmente vienen de otros estados. La edad que ellos tienen es la edad de los grupos que celebran, que se reúnen, que van a los bares y que en muchos casos no practican las medidas de prevención que hemos tenido en lugar acá en el condado.
Amanda Dukes from Channel 2. And Mayor, this is either for you or... Oh, sorry.
Was there a second part?
So the question from Telemundo is, after the governor's last executive eliminating the fines on businesses, what's the county's posture as we keep sending out the strike teams to these businesses?
First, let me just say that I heard Dr. Pino speaking in Spanish, and he said spring break. So it's the same in Spanish and English?
We don't have a spring break.
Should I translate that?
I was talking Spanish, evidently. You know, he said.
Many breaks in America.
Okay. All right. In terms of the governor's executive order removing the ability of local governments to issue fines, whether that remains in place or not, we are going to continue doing inspections to ensure that our businesses are doing the right thing with protecting our citizens.
En términos de la orden del gobernador de eliminar las facultades del gobierno local de imponer multas a los negocios, independientemente de lo que suceda con esa orden y del resultado, seguiremos adelante con nuestras intenciones de mantener a los negocios seguros y que operen de forma que cumpla con nuestras órdenes.
I really believe that our businesses want to comply.
Creo que nuestros negocios deliberadamente quieren cumplir.
We have received 99% compliance over time.
A través del tiempo tenemos un porcentaje de cumplimiento de 99%.
So less than 160 businesses have received warnings, or we've given less than 160 warnings.
Hemos emitido menos de 160 advertencias a negocios.
And probably under 30 fines have been issued.
Y una cantidad menor a 30 multas han sido emitidas.
And keep in mind, we have made over 9,000 inspections.
Ten en cuenta que hemos realizado al menos unas 9,000 inspecciones.
When we have thousands of businesses here in Orange County.
Cuando tenemos miles de negocios aquí en el condado.
So clearly, the use of the fine has not been the driving force to get most people to comply.
Claramente el uso de una multa no ha sido un factor para mantener los negocios en cumplimiento.
I believe our business owners want to be good citizens and help to protect our residents.
Entiendo que nuestros negocios quieren ser buenos ciudadanos y mantener a nuestros residentes seguros.
So the purpose of our compliance teams is to help those who want to protect others be able to do so.
Así que la labor o el propósito de nuestro equipo de cumplimiento es asistir a aquellos negocios que verdaderamente de buena fe quieren hacer lo mejor para proteger a otros.
So we're providing the technical expertise and supplies such as personal protective equipment, and other collateral materials to help them to be successful in serving others.
Proporcionamos experiencia técnica, materiales de colateral, afiches, entre otros, para ayudar a esos negocios a nuevamente mantener un ambiente seguro y que puedan proteger a otros.
Right. Muchas gracias.
Amanda Dukes from West TV. Mayor, I don't know if you want to take this, or maybe even Chief Egan, but it's about the efforts to vaccinate people in their homes. I'm curious, you said this is starting with placing hangers on the doors. What information is being shared? Are they at the point where they can make appointments to get vaccinated in the home? And what are you encountering? Are people asking questions? Are they open to it?
At this point, it's still early. They started today, so I have not received an update about the experience that the state is receiving. These individuals who are going out doing canvassing, they are contract workers who have been identified from the state who live in our community, who are being asked to go out and share information about the opportunity to be vaccinated if you meet the criteria in your home. And so they're providing information to our residents that we will be coming into your neighborhood in tandem with the canvassers and firefighter paramedics. Primarily it will be in the unincorporated areas of the county and within the city of Orlando, or other areas that we identify. And so within the next 24 hours or so, we're working with the state to identify additional neighborhoods that, again, have scored high on that social vulnerability index score. And typically, in order to score high, it means that a particular neighborhood or demographic has been identified as being disproportionately impacted of receiving the vaccine. So the goal is to increase the number of the socially vulnerable. Typically these are poor neighborhoods. Oftentimes they may be black or brown communities where we will be going into those areas with these people who have been identified as having health vulnerabilities. We will provide the opportunity, rather than them having to drive or be taken somewhere else to get the vaccine. The teams of these paramedics are going to administer it right there in their home. So we will build the list of individuals. We will use our emergency management list of persons who have been previously identified as people with special needs. We will be doing some outreach. We will be doing some communications through telephone outreach, sending text messages, using our OC Alert app, and I'm sure we will receive some calls from through our 311 system. We will take the list of individuals who are identified as desiring to be vaccinated in their homes, and then the teams will take that list on a daily basis, and then they will go and into the communities and be paired up with the state contractors. So you may see a fire truck or some other fire vehicle there. These men and women will be in uniform, so it'll be obvious that they are from our community. They're public safety officials, and the goal again is to increase the number of people who are getting vaccinated. And so we want good success. So we have to tell the story about where we will be, when we will be there, and that's the role of the canvassers, is to help notify the community that this opportunity is coming.
Melissa Thomas with Florida National News. This question could be for either Mayor Demings or Chief Egan, but just wanted to get the reaction from the members of the law enforcement, firefighters, that kind of thing, with the announcement that the eligibility is now expanding for the vaccine.
Come on up, Chief. Chief Egan, we'll let him speak from professional firefighter perspective, and I won't do that for him.
Good morning. I just wanted to make sure I had the question correct. You were asking how we feel as firefighters having expanded into our system. It's great to be able to provide that service to everyone in the fire department. We're all part of a team that makes this service available. It's not just those that are out making the response to the house. There's a lot of support on the back end, and that support now has a chance to be protected as well. Without those folks on the back end, our dispatchers, our administration, our finance people, the machine won't work without those individuals. So it's imperative that they are protected as well. So on behalf of the employees, I'm sure there's great appreciation that they're now able to be protected through the vaccine program.
Eric Mock, Spectrum News 13. Question for Mayor Demings. So you requested that all law enforcement firefighters should get the vaccine. That was successful. How long before you request more eligibility? Maybe not from the other age groups, maybe other groups. Like I know higher ed faculty was saying, they are around students all the time. And, who would you ask for and when might you do that?
Well, as you know, this is a dynamic environment that we're working in. And so over time, I've made various requests of the state to modify certain directives that have been put in place. And so that's all contingent upon what we are experiencing on the ground, real time. And so if we see where the available inventory of vaccine outpaces the demand, then we will ask for additional people to be included. So it's all based upon what we're experiencing. So I can't tell you when will I ask again, but I don't know that answer.
Steve Hudak from the Sentinel. This is for Mayor Demings or Dr. Pino. There were some reports today that there were some lines lagging at the FEMA site, and is there anything we can do to make sure people are taking advantage of every opportunity? What would you suggest that we do?
You want to take a stab at it?
Well, I think that this is a all hands, approach kind of thing. There are going to be many different strategies. Again, when you are doing vaccines, it's always easier to get to the 50%. It's harder to move above that 50%. Then it becomes very slow with any vaccine, basically. So that's what we have seen. I think increasing the ages and opening up is a way to be able to respond to increased demand for the volume that we have. Again, appointments were filling in 45 minutes. Now it's taking a week. And part of the issue is that we have vaccinated about 65% of everyone who is 65 years and older in the county. So now it becomes harder to reach into other groups that may not want to be vaccinated, or may be the individuals that they are having difficulty in transportation and all socioeconomic issues, and that's why this type of a strategy is also good. And remember, the numbers are lower than they are in reality because we are not getting the reports yet from the VA, which has vaccinated over 50,000 people. Now, not all of them are from the county, but I'm suspecting that a large number is due to our population levels. So this strategy will work. And we also work to just move a clinic into a block, a mobile clinic that is, and say, come on down, whoever wants to get the vaccination. And that's another approach that we are ready to take if we receive J&J, because that's a strategy that works once. You move the clinic, you vaccinate, you leave, you may not find those individuals again. So that's why this type of vaccine is very important. Thanks to the county has made a great investment in all this process from the freezers that we are using. So that county investment not only helping Orange, Osceola is storing the vaccine with us, the IMT is storing the vaccine with us, and the feds are storing the vaccine with us. And when I mean us, means the county. And so also was the investment from the CARE Act into acquiring a mobile vaccine unit. It's ready to go, it's full of supplies. We make a request to get J&J to this approach, and it could happen pretty soon, and that will be another strategy. So it's a diverse range of strategies, going to churches, speaking the language, using people who represent that community and look like that community and have the experience with that community. So those are all critical steps that we have to take to make people more comfortable about taking the vaccine. I think the politicization that we saw at the beginning had an impact, and so we are dealing with the sequels of that.
The only thing I would add is vaccine hesitancy remains a challenge, but we are working with various community-based organizations to develop plans to ask them to assist us and have them assist us in communicating the need to get vaccinated. And so we have a number of individuals who will be helping with that process. We'll be reaching out to some of our other elected officials when we have canvassers and firefighter paramedics in various neighborhoods. You will see likely some of our elected leaders and other community leaders who will be in some of those areas, and we would invite some of you to, when they do that, to perhaps cover some of those stories as they're out and about, and continue to encourage people to get vaccinated. There's still a certain number of people who don't believe in the science and for various reasons say that they are not going to get vaccinated. But we certainly hope that that is not the majority of people in our county.
This next question was texted in from Sierra Putnam with WFTV. It's for either one of you. Her question reads, how do you think this past weekend St. Patrick's Day events went, and how is the county preparing for Wednesday's St. Patrick's Day events?
So this is a good question for Tim Boldick. His team was out this weekend and visiting places, so he can tell you what he and his staff observed and kind of share with you how he thinks it went.
Well, I'll say, when we send the compliance teams out on, especially on the weekend, we're following up on a lot of previous non-compliance. There's a few proactive and then a few complaints in there. For the most part, I think we kind of expected some of the results that we received this weekend. Again, that doesn't deter us. We'll continue to keep out there, get the message out there. We're going to be consistent and find ways to help these businesses get to compliance, and we'll be out there as long as it takes. We're getting close on the numbers, and this isn't a time to let understanding that spring break is here. Certainly, I think Dr. Pino mentioned it. It's a group that likes to socialize a lot and go to the nightclub. So hopefully we'll get some personal responsibility isn't key in this time from this standpoint going forward.
It seems like after every major holiday, we have seen the numbers increase. We remain optimistic that won't happen this time, but if it does, it won't be because we didn't put forth the effort to try to convince our residents to work with us and to voluntarily comply.
This next question is for Orange County Public Schools. I know Sherry Babinski is here. This comes from Nikki Ziziza from News 6. Her question reads, as vaccine eligibility continues to expand and restrictions are lifted, will OCPS mandate teachers, staff, faculty to get vaccinated for COVID-19 before returning to in-person instruction? Why or why not?
The school board has not changed their position on this matter. They have stated in public meetings that this is a personal health decision, and they will continue, although we will encourage, we will not be mandating the vaccine.
And this last question is for Mayor Demings from Ryan Lynch in the Orlando Business Journal. His question reads, Mayor Demings, you mentioned economic recovery as one of the county's current goals. What steps do you expect to take in the coming weeks to help facilitate that?
Of course, we have provided funding historically to small businesses to try to get them back going, and we will be receiving additional federal dollars, and when we program those dollars, we will be using a portion of those dollars to support our businesses and hopefully stimulate our economic recovery. We're going to continue where we can offer incentives or what have you to other businesses that will pay higher wages than what we currently see within the average of our community. We're going to continue to try to recruit those businesses to move here and grow them while they're here. So just a couple of weeks ago, the Board of County Commission approved an economic stimulus package, if you will, to encourage diversification of our businesses here. And we're going to continue looking to do those types of things. Okay. We have one question. Okay.
Mayor Demings or Dr. Pino, you guys mentioned new FEMA satellite sites that will be announced soon. Do you have any other details on that? Can you expand on that a little bit, maybe where they're going to be and when we can expect them?
So I don't have all the details. It's a very fluid situation. We can get up to 10 mobile sites that will move around the county. But again, as the mayor indicated, they are in negotiation, how many people, what type of places. But so you know, we have identified by census tract how many people are vaccinated in each of the census tracts of the county. So we can surgically go and position vaccines very close to individuals who need it, or may have not been vaccinated, and give them that choice. It's always to the individual, up to the individual to decide if take it or not. But the resources are there and the strategy is there. All that we can do is put the vaccine there, knock the door, and offer it.
Okay, thank you, Dr. Pino, again. Thank you, Commissioner Gomez-Cordero, for being present today as well. Thank you to all of you. Our next press briefing is scheduled for this Thursday, coming the 18th at 4:30 p.m.